or I guess it's really the second one, but this particular one. The laws become effective April 2nd, or at least no later than April 2nd, 2020. And these programs run through the end of the year, December 31st. We're going to talk primarily about the main things we've mentioned. Emergency paid sick leave, the new term, EPSL. Another new term, Emergency Family and Medical Leave Expansion Act. Shortcut is EFMLA. Tax credits that are supposed to pay for these programs. OSHA requirements to address workplace safety. And then we'll just note that the rest of the law relates to nutrition and food assistance programs. It has some requirements of what medical plans need to do or allow. So all medical plans need to cover the cost of testing and treatment at no out-of-pocket cost to the plan member. And we are getting some feedback on the line still, so if some can mute the line.
Can anyone hear us speaking?
I can hear you.
I hear you, Rita.
Hear you. Thank you.
I hear you. I hear you.
Okay, thank you.
Thank you. Thank you for that feedback. Okay, so then there are some protections for manufacturers of respiratory products. And then there's some mention about funding for unemployment insurance and Medicaid, this part of the law. The next slide, please. Okay. So Rita, I've done all the talking. You want to walk us through?
Sure. So let's start with the FFCRA really is a program an act that encompasses a number of different programs. One of the programs that it encompasses is the Emergency Paid Sick Leave, or EPSL for short. This requires employers with fewer than 500 employees to provide paid sick leave if the employee cannot work or telework due to COVID-19. So the key thing to remember about this is that this leave is directly related to COVID-19. The impact is either directly on the employee or a child under the employee's care that cannot attend school or daycare because it is closed. So employees are automatically entitled to EPSL regardless as to how long they have been employed. If they started last week and they have an issue, or starting April 2nd, they are eligible. So there is no 30-day waiting period. And if the time off is taken for self-care, the employees must be compensated at the higher rate of either the employee's regular rate or the federal minimum wage. So this is important. Pay is capped at $511 per day with a total limit of $5,110 in total. If time off is taken to care for a sick family member or a child who's not in school, there's still coverage under this EPSL policy, and that pay is capped at $200 a day. And really what we're looking at is 2/3 of the employee's pay, and then the pay is capped at $200 per day, and this is for a 10-day period.
Let me please just say something about that 500 employee limit, that threshold. Many surgery centers are in a situation of being perhaps owned by a hospital or owned by a corporate partner or owned by some other entity, or an employment situation where the employer has more than 500 people perhaps. There's many ways to look at that corporate issue, but I will say that what we've heard, and probably all have heard from those in the federal government, is they're really trying to make this available to small businesses. And so it would be kind of going against the grain to try to stake out a position of this not applying. Now, could that be applicable? Absolutely, that could be applicable. But we just want to mention that the government probably would be more inclined to make a case against a party that got that wrong in terms of whether they're over 500 people. Whereas if you're conservatively saying this law does apply to us, then the government's going to look more favorably upon that. I know Speaker Pelosi has mentioned that, for example, that they really expect the large employers to follow suit in this law or what's going on here. And that's kind of the tone of the what we perceive as the practical implications of that number. Next slide, please.
So continuing on, again, the Emergency Family Medical Sick Leave Pay Expansion Act really applies to child care, disruption or quarantine isolation orders impacting those under the care of employees. It expands the FMLA on a temporary basis for employees with fewer than 500 employees. And what's interesting about this program is that it allows for up to 12 weeks of job protected leave for each employee that has been on the payroll for at least 30 days. Now, in this particular situation, there is a 30-day wait. So the EFMLA is just slightly different than the EPSL. So just something to keep in mind. The EFMLA also provides a job protection for up to 12 weeks. And it's also about providing pay for employees for weeks 3 to 12. So the first 2 weeks would be covered for the employee's own EPSL, but then anything over and above that is pay for EFMLA, and that is not for the employee's own illness, but in fact for this portion of the leave that is all about caring for a child under the age of 18. So under this pay, the employee is eligible for 2/3 of the regular rate of pay up to a maximum of $200 a day and $10,000 in total. So yes, you are paying leave for weeks 3 to 12, so a total period of 10 weeks. The employer is not required, may not require an employee to use other employer-provided paid leave before the employee utilizes EPSL. So that first 2 weeks has to be EPSL, and then after that, the employee will be paid under this other program, which is the EFMLA. So if I can get the next slide, please.
Thank you very much. So here are some specific questions that we've come across as we've implemented the rules of the new law. And we'll just say up front that there are areas yet that are undetermined by the regulators. The primary regulators in this law would be the Department of Labor and the Department of Treasury, or IRS. And so there's still some information yet to be sent out and yet to be determined. But there's an overall blanket protection for all of us, and that is that if in good faith we're making decisions about implementation of this law, and we are making those decisions in good faith, then the government has a moratorium on any enforcement action against the party that's acting in good faith to try to implement the law.
Could we please have everyone? Thank you. Like FMLA, an employee takes intermittent EFMLA. So these are some of the questions that we're getting. So, under EFMLA, I'm sorry, we are getting a lot of feedback.
We've got a lot of background. I can't hear anything. There's a lot of background.
Me too.
Sounds like everybody needs to put their phone on mute.
Is there a way to mute everybody?
Ask you to mute everyone on the call, please. Thank you. Okay, like FMLA, can an employee take an intermittent EFMLA? And the answer to that is no. What is going to happen here with EFMLA, because this is a temporary act, once the employee starts their leave, that leave is a continuous leave. Yes, an employee can return sooner from a leave than not, but that period of time, once the employee starts the leave is continuous, and if they return, then the leave ends. And again, the period of time that they're taking this EFMLA is subject to a maximum of $200 per day. So there are 2/3 their salary with a maximum daily rate of $200, and then for a total of $10,000 during this 10-week period. And if we can go to the next.
Right now, and are employees eligible for this leave? And that's one of the main questions we're getting right now, obviously, because I think a lot of surgery centers have proactively, or because the state has requested or demanded it, they've shut down for anything except for the most important cases.
So what's happening right now is timing is everything. So because this plan doesn't take effect until April 2nd, anything that happens right now would be covered under regular family medical leave. If they are themselves ill or taking care of an ill family member, so they just have to qualify it under FMLA. Until that point in time where we have clarification on the law, this is what we're going to do ourselves. If somebody finds themselves in a situation they would cover, we would go ahead and look at this in terms of April 2nd being the start date of the program, and we would move forward from there. So what happens if an employee starts their leave and subsequently the center closes? This is going to be one of those situations that we'll have to watch carefully, but right now, part of the requirement for EFMLA is that the surgery center be open and available for work. So if the surgery center closes, then of course, there's no work to be had, so the leave would stop. If the employee is in the condition of qualifying for this leave and they're eligible for leave and leave the day that the ASC reopens, then again, their leave would start. If the ASC reopens and then the employee later becomes eligible, again, we would follow the rules that are in place. But again, I think the most important part of this is to remember that things change and they're changing on a regular, ongoing basis.
Yeah, so we're going to keep tracking the rules as they continue to be published by the regulators to get clarification on some of these matters. But and we still have the overall 30-day window here that we're in, and we're going to operate and make decisions on a good faith basis. But as described right here.
The next slide. Okay, so some of the other questions that we've received. If I'm an hourly worker and I've averaged more than 40 hours of work during the most recent 2-week period, am I entitled to more than 80 hours of EPSL? No, general wage type benefits, and that includes PTO, vacation, sick leave, whatever you're calling your program, your benefit type program, are typically capped at your normal 40-hour per work week level. So that is all that the individual would be entitled to. And again, there is a proration if that individual averages less than 40 hours a week.
And then the question came up, one of the provisions is that if you're an employer with fewer than 50 employees, you may have a way to not be under this law. Well, it's a pretty high standard, this going concern standard. That's basically the kind of standard that an auditor might come in and look at you as a financial audit and say there's real question marks whether this business will continue to operate for the next 12 months or not. Could that happen right now? Of course it could. Just be careful if that's your situation. Obviously that's a very challenging situation. But if there's any doubt, if it's really, in other words, that rule can't be used to just kind of get out of the requirements here. That has to be a real issue of a going concern.
Yeah.
Next slide, please. So tax credits. The way the law reads, it's a credit against the FICA tax. That's in the rule itself. But what's happening is the IRS is actually being very helpful to employers in terms of supporting cash flow needs right now. So the typical tax due from just FICA, for example, right now in any given payroll may perhaps and very likely be less than that tax amount, that FICA tax amount may be less than the total leave paid out during a pay period. And so the IRS recognizing that is allowing employers to withhold payment on all payroll tax as a way to fund the cost of the leave. So all of the payroll tax includes employee withholding tax, employee portion of FICA and Medicare, and employer portion of FICA and Medicare. So all those funds can be held and used to pay for the leave that's paid. That may end up being different, however, than what the final tax liability and tax credit is at the end of a quarter, let's say. So it's a good, generous benefit from a cash flow standpoint, but it's not necessarily the same as what the credit will consist of, if that makes sense.
Let's talk a bit about wage and hour issues. So, you know, these are questions that continue to come up now with centers needing to reduce hours and the like. So must we keep paying employees who are not working? The Fair Labor Standard Act is pretty firm in its writings, and that is that anytime an hourly employee is not working, they are not eligible for pay. So employees who are not working are not entitled to pay unless they fall into one of the new categories for FFCRA. So what happens if someone sends, this was another question under the wage and hours area, what happens if the worksite sends someone home out of concern for contagious illness? So again, if someone is sent home due to non-COVID related illness, follow your policies for return to work protocol. Employees should be allowed to use their normal regular PTO sick leave according to your handbook policy. Another question that has popped up quite a bit is, can employees decide to self-isolate for fear of contracting COVID-19? And we're getting this question quite a bit, and our answer right now is that an employee who is concerned and not otherwise can request time off. And we recommend that if they are that concerned and you can afford to have them off work, you allow them to take their time off. It is up to the discretion of management to allow for time off in these circumstances, and time off would be covered by whatever PTO leave they have. Can we charge time away from work to vacation and leave balances, PTO? This is, again, a policy question in general. If employees miss work time from work, you are going to pay paid time off balances that can be applied. But again, keeping in mind that the FFC rate pass, so if you're looking at an individual's own illness or the reason to be away from work is to care for a child under the age of 18 because school is closed or child care arrangements are not available, just contact your human resource department to start that process after April 2nd. You know, and we talk about a lot of different things in this section, but there are just a lot of the questions that came to us as people were registering. One question that came up was, I had a vacation planned for September and I don't want to use my PTO now. What should I do? So again, this is a situation where a surgery center may be closing or may reduce hours and they're asking employees to use their PTO, but this person wants to save their time. Our recommendation is always that you work with your administrator. Given the current situation, some AAC management are considering options. This is a local decision your management team. Again, if either EPSL or EFMLA apply, those would take precedence.
We just say, you know, the scenario here is, I think as many of you know, once we kind of get back to work, we may have a rush of cases. We may have a rush of demand for things that have been put off. And so it might be busy and there may not be availability to allow PTO for somebody who wants to go on vacation, you know, shortly after the surgery center reopens. So it's going to be one of those scenarios where people have to work together and cooperate with each other in terms of when the timing of certain vacations and those sorts of things.
Right. So another question that is because of the Emergency Paid Sick Leave Act and EFMLA is that does an employee have to exhaust PTO? And the answer to that is no. As a matter of fact, the new law specifically states that EPSL takes precedence. After that, you know, they also apply for EFMLA. That will take place as well. So then the question becomes, you know, they're limited as to pay. EPSL will limit them to $511 a day or 100% of the salary, whichever does not go against the maximum, which is $511. day, a total of $5,110. So again, you have to keep in mind what's going on for emergency paid leave. They're fine with that. It becomes more of an issue when they go and really if they're applying for the leave they're receiving.
It's really difficult to hear you. You're in and out.
Yeah.
We're getting quite a bit of feedback on the line as well. So just encourage people to use your remote or use your mute button, please.
Okay, can we move on to the next page? So another question that has come up quite a bit over this period of time is what can we do with exempt level salaried employees? We're answering this question and we're going to make the assumption that the center is open, so there's not been a general shutdown or temporary layoff, furlough. Some of them are synonymous terms, so there is some business left to conduct. So normally what happens in this situation is exempt workers get paid 40 hours if they work at any point during the work week. The FLSA does allow, in periods of economic downturn, and I think that everybody would agree here that this is an economic downturn, that this rule can be relaxed as long as the employee still receives at least $184 a week. So what happens is that an exempt level employee can choose to volunteer to not work or not get paid for those days. But really what you're doing is an annual salary reduction at this point. So you have to think in this in terms for your exempt level employees as a salary reduction so that they are receiving less than their normal pay. Also, an exempt level employee can agree to a salary reduction for the days that they work, but really what you're looking at is a salary. So they would be paid the same even amount. So that's what salary means. You get paid a same consistent amount week over week or by whatever your pay period amount is, as long as that salary does not dip below $684 a week. But again, you would be resetting your exempt level or your salaried employees with a new annual salary, and then that salary is divided out over the pay periods. So if we can move to the next page. Another question, and again, all of these questions will have to do with pay, and it's how can we be financially supported if our center can only pay us for 20 hours a week?
And this question, came from somebody concerned for their situation, as many of us are, and it's a very good question because it's a very practical question. And some of the rules of the FMLA, the emergency FMLA, the emergency paid sick leave, some of that supports an individual in this situation. But there are also other avenues. So there's also unemployment coverage in your state unemployment office. And, we should all remember that there's still a law pending and being negotiated, et cetera, in Congress to provide further assistance for individuals and small business. So, we're kind of in the middle innings of a baseball game, so to speak. There's still more games to be played in terms of finding out what the rest of the benefit's going to be. So what we're talking about here is what benefit has already been approved by Congress and signed by the president.
Right. So unemployment is a state by state, so this question is always a little bit harder to answer. So yes, state by state unemployment rules are being relaxed. Mostly states are waiving the waiting period, the 1 week waiting period, and then they do allow for a reduction in hours kind of pay, so a reduction in benefits. So if an employee goes to their unemployment office, and we're recommending you do this online because phone lines are flooded, employees can apply for partial unemployment. And during this period of time, the employee is allowed to work. Each state has its own maximum number of hours or maximum amount of pay that they can make. But I think that every employee also needs to go through and each website for unemployment has this test that shows whether they'd be receiving a benefit, because each state has a different limit by week of how much someone can make or how much the benefit is worth. So again, we don't want to overpromise.
All right, next slide, please.
Yes, I would like to ask the question of this. If you're unemployed, take the unemployment, do you lose your MedHQ insurance?
Yeah, that's a great question. That how does this interplay with benefits? I said, slides coming up talking just to that point. So if a person is laid off or reduced in terms of pay or reduced in terms of hours worked, number one, many carriers right now are relaxing the rules around being eligible for benefits. So to the extent that we can do that, we're going to do that, and I'm sure many other employers are also going to do that same thing. However, the important thing is that the premiums still need to be paid. And so if the employer each month is still paying their portion, and then the employee still has to pay their portion. If the employer is shut down and people are in a COBRA situation, the premium still needs to be paid under the COBRA rules. So really it's kind of the traditional way of looking at it in terms of the premium has to be paid in order for the benefit to remain. However, the carriers are looking at relaxing eligibility so that if it's usually 40 or 30 hours, let's say, to be eligible for your benefit, and you're only working 10 hours or 20 hours, those kinds of eligibility rules, the hours are being relaxed typically right now, but yet the premium amounts still need to be paid.
So this is another question that came up times, and while we don't want to think of the more extreme end, life insurance would still be, any claim under that policy would still be treated as any other illness. We've confirmed with our own carriers that there's no applicable act of God exclusion. This is true now for coverages for employees. I can't say that the same is true for business insurance and the like. So this is strictly applies to what we're talking about here, which is employee benefits. We can go on to the next screen. How about 401k loans? Thing that, again, has come up as questions. Many people are concerned they won't be paid. They won't have a deduction for their 401k loan. They always have the option to make that payment directly. But what happens if they can't make that payment? Well, there's also another act that is in play right now, has not been implemented. We are working with our 401k plan administrator as well. But right now it has not been decided. But there is an act that is currently in play that is looking to relax any kind of tax penalty that takes place if you miss your loan payment that went to default. They're looking at extended periods of time that people can make these loan repayments. They're also looking at what happens if, in fact, a loan goes into default. Typically, you have to pay the tax and the penalty in the year if it happens, and they're looking at extending that over a 3-year period. But again, this is another one of those things that is up for vote. It is not finalized yet, but just to give you an idea that every aspect is being looked at by everyone. It is really something that everyone is looking out for the best interest of other individuals. So just stay tuned. We will provide more information as it becomes available.
On the topic of 401k, I think any of us who are kind of elders in the room, so to speak, have unfortunately seen some of these events happen over the last 20, 30, 40 years of kind of market crashes, market corrections, whatever it is. I would just, I guess I'm speaking on behalf of our 401k financial advisor for the plan that we have in place. They wanted to, and we will, to center around a communication to kind of emphasize the idea of think through what you want to do with your plan right now and your funds. The slide our financial advisor wanted to send out shows the amount of money lost because somebody decided to get out of the market at the wrong time. And trying to time the market is very, very difficult, only for the top experts in financial services. So we would just forewarn everybody to think carefully before you make rash decisions about your funds and where you have your money. Certainly it's up to you, but think through that, because you don't want to, the old adage of buy low, sell high, if you think about it right now, to sell and get out of the market, you're selling low. So you're kind of going exactly against the mantra of buy low, sell high. So just a word about, we're not financial advisors, we're not legal experts, but just from a practical point of view, that's what we see.
So I called my professional people that are carrying my.
If Dr. Stevens' case doesn't go forward.
Okay, we're going to keep moving on through the presentation, okay?
Okay, so another question that has come in, we've kind of ranked ordered these by the number of questions we're getting. Where should I go for care if I myself become ill? So we are certainly recommending that you seek care in the following order. Contact your own medical provider by phone. Most providers are all requesting that you call them, and they'll give you advice as to what to do next. Teledoc is another great option if you're covered under the MedHQ medical plan, but any plan that offers telephonic service where a doctor can treat you over the phone and give you further advice. If you're really faring poorly, then urgent care center and of course the emergency room. But everyone has seen the news, sees how overwhelmed these places are. So really calling one of these services is best first. But at the end of the day, you have to take care of yourself, so you need to do what is right for you. If we can move to the workplace safety for a little bit.
So, what is an essential business? We're all in the situation working in the surgery center industry. We're kind of half in, half out. Been quite a bit of news about this and quite a bit of discussion among local governments and state governments about, trying to marshal resources for the really critical needs. And so they're asking, of course, surgery centers to only do the most important cases. So obviously, what the doctor decides to be necessary care, that's the rule of the day, and other things being elective. But that's an important thing. Generally then, other industries that we see out there that are considered critical, these are your emergency personnel, whether it's firefighters, ambulance, or police, and a whole number of other areas. But it includes, personnel resources. It includes accountants and advisors. It includes distribution and retail, grocery stores, all sorts of other things. But the point of the matter is, here in healthcare, we're kind of half in, half out. Other thing going on though is there's been quite a bit of a call to look at surgery centers as a possible supplemental resource in certain situations where there is really high demand on the local hospitals. So keep an eye out for that surgery centers may be called upon as an extra resource there.
So, continuing with the workplace safety question, the other question we're getting quite a bit is, what happens if an employee appears sick? As with all cases, when an employee comes to work with a fever, difficulty breathing, they should always seek medical advice. This does not necessarily mean that someone has COVID-19, but please train your supervisors on the importance of not overreacting to situations. And remember that you already have protocols regarding employees and being well and being able to care for others. So keep that in mind. Along with that question we get, can I send an employee home or somebody has put us on hold. There we go. And then, yes, you can ask employees to seek medical attention, and you can ask them to leave work until such time their medical providers provides the clearance to return to work. So those are all things that are, if you take a step back, I think that you do every day, even prior to COVID-19 or the coronavirus, and we want you to keep those things in mind. And yes, take extra precautions with COVID-19. You have the next slide, please. This is a hotly contested one, and that is, can I take an employee's temperature at work to determine whether they have COVID-19? So this is a very, very hot topic, and both the Americans with Disability and the EEOC consider taking an employee's temperature to be a medical examination. The EEOC is now allowing employers to take temperature of employees when there is a reasonable assessment that an employee may have the virus and that they are also in a situation where they can possibly spread that virus along to others, which basically means that they're in the workplace. So again, we want to make sure that we know this, but here's the other part of that. Not just anyone can walk up and take someone's temperature. You have to be properly trained, and RNs are certainly trained for this, and the process needs to be safe. Again, you have protocols that achieve this. Just please coordinate this with your infection control leadership. Another question that came hand in hand with that was if we could ask patients to self-test prior to arrival for procedure. Well, this is another one. OSHA has announced that emergency rules for COVID-19 outbreaks require businesses to have certain high-risk job functions conditions in place that protect the health and well-being of the employee. Your infection control leadership will typically address this policy. So we, as human resource management providers, we can't tell you what to do with your patients. That is something at the surgery center that gets determined.
Next slide, please.
Well, here's another thing for workplace safety. What steps do we take if we use chemicals to combat COVID-19? This was particularly important. A couple of weeks ago, I think everyone is pretty much but if you introduce any new chemical into the workplace, remember you have your OSHA hazard communications, your HAZCOM communication standards. So if you're introducing a new product into the workforce, you know that you have to train your employees on how to use these new products and safe storage. Another question that came up in workplace safety is, can we prohibit employees from traveling to non-restricted areas on their personal time? So generally, you cannot tell an employee they can't go on vacation to a specific place. You can and should monitor employees returning from travel to risk environments for signs of illness, and as the illness has progressed, you're also allowed to ask employees to stay home for a 14-day period following any two areas that have had serious impact. And we ask that you human resource person for some guidance on that. So what should you do if an employee has recently traveled to an affected area and you think that they might have been exposed? The EOC has now taken to, with some instructions for employers, that the assessment by the CDC or Public Health Authority provides objective evidence needed for any kind of disability-related inquiry or examination.
So does the COVID-19 emergency have an impact on HIPAA privacy issues? In fact, no. You know, the typical HIPAA protections for privacy are still in place. Even if you're doing something as simple as taking somebody's temperature, a coworker's temperature, whatever result comes out of that is a protected bit of healthcare information. So be very careful about that you don't disseminate and share that information in an inappropriate way.
Right. But also, in addition to that, you know, there's temptation, and if we can move on to the next slide, there's a temptation sometimes. Okay, I think that maybe somebody has been exposed, and now I want to alert others that they may need to self-quarantine. You want to make sure that you are covering this issue very carefully, because while you can alert others that they need to quarantine, you cannot release the results of an individual or an individual's name. This is covered under the Americans with Disability Act. So anytime you treat someone as disabled, you can trigger that ADA coverage, but it's really very, very important that you keep this in mind, that again, you not share anyone's private medical information with others. You can in general, and you're obligated in general, if people have been exposed, to make that statement, but not by whom or why or what happened. So again, make sure, and that pretty much covers a lot of the couple of questions that we have on this page here.
One is, in particular, is can I send somebody home that as a manager that I think might be exhibiting some of the conditions, some of the symptoms of the illness? And yes, you can, but remember, you got to pay the employee that you send home for that day.
And again, following up on what we've been talking about with DFMLA, does traditional family medical leave still apply? And that's yes. And people will still get sick from other items. People will still have other illnesses, have other child care or family care needs that are covered in the Family Medical Leave Act. The new act does not take the place of the old act that has been enforced, and so FMLA continues. Although you only get one or the other.
Regarding what does it mean? What does temporary leave mean? What does furlough mean? How does the government interpret these words? How is that the same or different than layoff or temporary layoff? We would just want to address that because I think there's a lot of questions about that, and understandably so. So, furloughed workers, we would use furlough, temporary leave, temporary layoff, those three terms pretty synonymously. The difference is, what is a true layoff? Well, one definition, one primary source for that definition is the WARN Act. The WARN Act, as many of you may know or probably know, it applies to large employers, and it covers situations where there's a layoff that's expected to last 6 months or longer without any intermittent work in between. So that's a layoff, okay? Furlough, temporary leave, temporary layoff, we are taking to mean anything that's certainly less than that 6 months, and usually 2 to 4 weeks is what we're hearing surgery centers are contemplating right now. So 2 to 4 week time period is definitely temporary, and therefore not a WARN Act situation. You're part of a large, and let's say a joint venture with a larger entity. This is temporary in nature and not needed to be a 60-day notice and all those sorts of other things. Okay.
Can we have the next slide, please? Here's where we want to start taking some questions. Okay, so we've had some questions from the audience, and I'm going to bring up some questions, and we'll answer them as we go along. So the first question being, can our 401k administrator consider whether employers and employers can turn off their contribution and company match during this phase? There has been no authority yet that's into not making compensation eligible for 401k. Now,
remember, if you could please, if you're on the line, to your phone and mute, please.
So 401k continues to be a question that is, again, there's an act pending, but there has been no final resolution on that.
So in terms of making changes to your contribution amount, that's the same as before. So you can make changes according to your plan documents, and typically those changes can be made monthly.
And as soon as more information is available on that, we will let you know. Again, we're getting a lot of questions that are related to specific situations or someone's own personal situation. We will attempt to answer these questions directly with those participants. So again, we appreciate your taking the time to listen.
And hopefully this is very helpful, for those who are on the call. Sorry about the technical difficulties we've had as we've gone through the call. We'll certainly iron those out and have it under control in the next call. We're going to do this weekly is our plan right now. So next Tuesday afternoon, we'll be hosting another call. We expect that hopefully there will be a new law signed.
Yes, we
maybe
do.
Today, tomorrow, I don't know. And we're going to do the best we can to dig into that one as well and see how it adds to what we're talking about, changes what we're talking about, et cetera. Also, as regulations get clarified about this paid leave, emergency paid leave act, we'll clarify as those things are clarified for us. Thank you all for joining the call. We hope to see you next week, and have a great rest of the day.
Right, and we will be distributing the slides from.
They'll come out shortly. Thank you.
Thank you.
Bye.
Thanks, you guys.